Hi everyone, good morning. Welcome for SEAR IMechE webinar. I hope all of you find healthy and fit and keeping safe of yourself. Today's webinar is all about COVID-19 health updates and advisory. Today is the first time ever webinar health sharing in the SEAR IMechE webinar. I have chosen these topics. This is part of the social responsibility to sharing and educate our peoples, students, and also the publics. Today is the 1st of August, Saturday, 10 a.m. We're going to start our webinar. So my name is Pragash Krishnasamy. I'm the IMechE Fellow representing IMechE YMS. Let me introduce what is IMechE before begin the discussions. Talking about IMechE was it is an independent engineering society of mechanical engineers. It was founded 1947. It is about 173 years in the industries. It was headquarters in UK. Um, what they are doing, basically IMechE is doing, is a networking section, technical talks, site visiting trainings, and also engineering competitions. And in Malaysia, we're looking at student registered under the IMechE is about 3,721 students, and the associate members is about 175, and members about 400 something, and fellow is about 60 hours. So today we're going to have a discussion on the COVID-19. Um, Let me introduce our panel discussion. Again, my name is Pragash. We have Dr. Tirumal from Medical Board. He is representing from the Kota Baru Hospital, and he is a final student of emergency medicine. Probably, doctor, you can say something about you.
Good morning, guys. I'm Tiru, emergency physician in training in Hospital Kota Baru. Hope this session will be beneficial to all of us.
Okay, thank you, doctor. Highly appreciate your valuable time, and also proud you be a part of the IMechE for sharing our thoughts, and especially from a medical point of view to our peoples, so that we could see the trending is increasing in Malaysia especially. So we would like to have your insight to educate people to stop the COVID-19 chains. So let's begin our discussion. Okay, okay. We are talking about OHA here. Is the whole world we know about COVID-19, and especially everyone knows about COVID-19. Nevertheless, we would like to take this opportunity to informing about the risk opposed to the COVID-19, and we also like to sharing the mitigation and also to reduce the contingent cases. Most of people have been educated from the social medias and posters in office or in public places. Nevertheless, as the IMechE, we would like to rephrase it to re-educate people for stop the COVID-19. So this will be a golden opportunity for people's about less exposure or information on COVID-19. So this is will be agenda we're going to discuss. The agenda first will be covered about hazard. Hazard is all about the source of the harm, and followed by the risk exposure, and also finally the least is the mitigation. And so this will be addressing about what are the source of, what will be impact, what is the mitigation plans. Um, Hope everyone has the understand about this. If you have any question, please posted your questions on the chat box. So at the end of the session, we will have you discuss about your questions, and there will be a feedback for you guys on your questions. So hazards. So we're going to discuss about hazard. First of all, we're going to discuss about pandemics, and we could see from pandemics, which is started on 1910, is now is about 1920. Is about we could see from these about 110 years, the pandemics wave has been gone through, and we have faced a lot of type of pandemics was the 1990, 1910, 1918, influenza was 1957, and also it could see about 1.5 people dead on 1957. And all along we got it 2019 on the COVID-19, at least was the recorded as of May was 282,000 peoples. So we could see the tremendous risk on COVID-19 comparing to the previous one. So this is where the pandemics kick off and people start to aware, and government and also WHO has been published. So, and the epidemiology, when we're looking at this, most of people knows about this, and we could see this will be rephrasing. About 31st of December was the first case was highlighted in the China, and followed by January 7th, 11, and 13. So end of until February 14, which is most of people well celebrating their Valentine's Day with their loved, and another way we could see the race is coming. So where the epidemiology and reflects the pandemics, we could see the race is coming to another wave. So during these sessions we could see the risk is very serious, and we are facing this. So in Malaysia point of view, so, Doctor, what's your opinion? How do we be prepared? Are we having a system in Malaysia to measure or manage the risk pandemic, something like this? Previously, have we gone through? And nevertheless, for now, we actually, especially the KKM, managed very well, and we are really proud about KKM. And achieving the COVID-19 reduction. What was the plan and the pandemics in or the recovery plan we have in Malaysia, Doctor?
Thank you, Mr. Prakash. Okay, the question was how we're going to manage pandemics in Malaysia. Okay, we were not, but we are now. Okay, I'm talking from a medical point of view. Okay, we had a similar issues before this in the form of avian influenza, SARS, and MERS-CoV, but not as bad as COVID-19. As COVID-19 is a novel coronavirus, when we talk about novel, it means it never been recorded in human being before this. Coronavirus is seen in human being, but this particular type is not seen in human being. So there's a lot of things need to be known before we can fight it. We don't know how it spreads, how long it can stay on surfaces, how fast it multiplies, what is the infectivity rate, how it affects organs in the body, how it causes death, what makes people more susceptible to disease. So we need to gather enough evidences and experience from other countries. We try to implement things that worked in other countries, like lockdown in Wuhan and death rate in Italy. You know, we used to talk about the flatten the curve. Okay, actually, it doesn't concern non-healthcare people. Any infective disease will take a bell-shaped curve against time. New people will get infected exponentially until it reaches a peak, then it will come down. That is normal disease process. We just don't want the peak to be higher than what we can cope with. Our healthcare resources is not infinite. We have limit. We only have a certain number of ICU beds and ventilators. We don't want things that happen in Italy happen here. We don't want to decide who lives, who dies. That's the reason MCO was implemented to reduce the infective rate and allow KKM to come up with a further plan. So what we did was we freed ICU beds in GH. We postponed or cancel all non-emergency services like clinics or operations so that we can keep the beds for COVID patients. And we even built a 1,000-bed temporary hospital in Sedang within like a 1 week. And so all these things, for now, I guess we are more prepared for the pandemics in case it happens again. We means both the KKM and Malaysians together. Okay.
Okay, thank you, Doctor, for your feedbacks. And really, we are proud about KKM, which is managing very well. And we also support the people, Malaysian, who are continuously following the advice from KKM to achieve our goal. And for now, we are managing at this moment. We are also could see the increasing and second or third wave now. So followed by sorry, how to say? Okay, so now we are discussing about what is COVID-19. COVID-19 is we could see a family of virus and respiratory tract, and it also a cold disease coming from phenomena, and also we could see the coming from the wild animals, and also it also transmit to the human and respiratory droplets from the people when we talk. So mostly we could see these are the element spreading on the COVID-19, and the structures of the virus looks like this. So the image is actually showing the structure of the virus. So in terms of this, the virus and looking at the phenomena, the doctors, what are the research methods or the testing methods applying to detect people's whether they are infected, and how was the testing carried out, and what are the research part of medical board is doing, which is people don't know about? Probably doctor can share about this.
Oh, okay. To diagnose the COVID-19, we need to do a real-time PCR. PCR stands for polymerase chain reaction from samples taken from a back of throat or mouth. Okay, it is not a pleasant experience to poke deep into your nostril. Just imagine digging your nose and accidentally you poke deeper. It is painful. Okay, what we want to see is presence of parts of virus inside the body. We want to see the virus. Okay, it can tell you two things. First thing is whether you are infected currently, and second, whether you can infect others. Okay, that's the only test we are doing currently. Last time we used to see in a social media, people are not happy that we are not doing enough tests. Okay, this kind of test is actually highly sensitive test that requires expensive machines, reagents, and expertise to interpret the results. So technically, new labs need to be accredited before we accept their results. Let's say before this, only the KL branch can do the test, and then if let's say Ipoh branch find out there's a COVID patient and they say it's a positive, they have to send the sample from their lab to KL to make sure it is really positive. Then only all the other results from the Ipoh will be accepted. So that's the reason we're able to test from few hundred samples in the beginning to almost 10,000 samples in the end. Okay. Another thing is whenever there's a chance of making money, people will jump in. Okay. So people, what they did was they introduced a blood test where you just take one drop of blood from a finger and use a test kit, and it will tell you the results in minutes. Okay. The problem is it depends on your antibody. Antibody is something that you produce for the virus. It's like an antivirus. So it can tell you whether you're infected, but it's not going to tell you whether you can infect others. So it's not really, shouldn't fall for that. But now, we even using the test kit for people who are quarantined. So after they usually check your the COVID test on the first day, and then they put you in a quarantine. And the 14th or 13th day, they recheck again. So for the 13th and 14th day, they can use the test kit to see whether you're really infected or not infected. So there's some changes because it's a new virus. Every single day we are learning something new. So far this is the updates regarding the testing.
Okay. Doctor, if I understand correctly, the testing kit is only a screening tools where upon that we have to be followed by the medical, we just through the check. Am I right?
Yeah, if we usually the COVID 80%, more than 80%, people we won't need any treatment. Actually, that's the truth. But we are talking about a large number of people. Even 2% out of 100 million will be a lot. So there's a certain number of percentage of people who will need extra treatment, mostly the elderly people. So yeah, that's the reason.
Okay, thank you, doctor. Okay. So next followed by the origin of virus, we could see from the image itself, we could see a number of uh, camels and bird family and also the cat families. So the where's the origin of the virus, and we spill over to the factors of where small droplets from the nose or the mouth while we are talking to the people, where to the infection to others, and where it is also spreading by droplets when touch the droplets, and then without knowing that we put it our hand from the surface where was the droplets, and we put it to our faces, so there will be risk. So and most of the people, there's the reason we say is that try to avoid placing your hand on your face, and while wearing your mask, and also remove your mask, you have to desanitize your hands. And we have to do this, the main reason why we have to go for desanitization. And in terms of the history of entomology, we could see a numbers of animals or the bat families or the bird families. We could see the camels, and is coming to 2019 now. We unknown about exactly coming from where. So these are the history of the animals. Brings the virus to the human being. So we need to be aware that what are the upcoming. So and from the virus point of view, we have see the people sneeze while talking. So most of the people I could see sometime, even in the public area, we remove the mask while we eating, so the people coming and serve the food, or the person who serve the food, so the risk is very high. And we could see in office people will start to discussion, or even though there's 1 meter distance, when people talk, sometimes they are droplets is spilling on the board, on the desk. And typically we are looking at the virus leaf on the surface. Doctor, may I know how long the virus can remain on the surface, which it will be actively when can be a potential transmit to the people?
Uh, okay, actually it is days. Okay, it can stay on most of the surfaces for few days, including tabletop, doorknob, plastics, or metals. Like some metals like copper, it can last up to 4 hours. Okay, just because it can stay on the surfaces doesn't mean it will infect everyone. There's a risk, but the risk is lower compared to human being. The main source is always another human being. It is transmitted with close contact with respiratory droplets. So whenever the person coughs or sneezes, so the best choice is to wash your hand regularly and wear a mask. Okay, if you want to disinfect your working space, then you can use bleach. Okay, there's some calculation. Usually, it's a one part of bleach to 30 or 50 part of water. Then you can use it to clean your working space, or you can use 70% alcohol. I know if we go to any shops, they give you some fluid, and we assume it's not really going to work. You need alcohol 70% for you to kill the coronavirus, or you wash your hands with soap for 20 seconds. Those kind of things. Uh, these things are not to prevent disease. It's just to make yourself happy that you're doing something. Okay, okay. And then recently we saw like some people, some companies use a disinfectant booth where you go in and then they spray some fluid. And actually, we are not inorganic material. We are human beings. So those things are not uh, recommended. Okay, people got sensitive skin, and it's not going to helpful in any way. So the important take-home message is, even though we say it can linger on surface, that doesn't mean it can infect you. So the best bet is wash hand, wear mask, but make sure you wear the mask properly. Stop touching eyes, nose, and mouth. I know this one is easier said than done, but these are the ways. Okay, I think that's all.
Okay, it is agreeable, doctor. As even myself feel very difficult to manage the hand movement or hand placing. Most of the time, we want to use the mask and we just quickly remove it or wear it without desanitize the hand. It is was very challenges, and I was wondering how the children at the school are managing it. So the risk is also could see from my point of view the risk is high enough for the children, where even adult we feel very difficult to place our hands, and how about the children's. Okay, that's good enough. Okay. This is a hazards we're looking at, the symptoms. So the symptoms we will have the short breath, and some will have high fever or vomiting and phenomena, and also coughing and diarrhea. This is typically my understanding is not all the symptom will be occurred to the people, but nevertheless these are the symptom to indicate the person are potentially infected by the virus. um, and the most importantly we need to understand, or don't take it complacent or fever probably I take a Panadol. So we need to be very conscious that when we have symptom on this we have to take precautions by doing the following things. So by this is a 5 step we encourage. This is the worldwide was using. We have once we have the symptom detected, or we have feel that there was a symptom we could see, and we have to be called to the region for certain, like example, if you're in KL, we have to call the KL hospital that you have a symptom, you are coming there, at least a notification to the hospital, so at least they are prepared. Most of the cases we could see people just walk in like a normal patients, end of the day we could see they are infected. As a social responsibility of as a human being, with a positive soul, we need to also protect others, and therefore as a precautions or the proactively we encourage people to call the hospital that we have some symptom, probably could be or could not be symptom or the virus affected, but nevertheless we would like to inform them. So these are the things people need to do proactively prior to going there. At least the doctors or the hospitals is prepared. Uh, and The step 3 shows that home test. So this is typically sometimes the hospitals doctors will give advice what to do prior to coming to the hospitals. So some rather that there also initial discussion we was shared about a rapid test. So some of the people also do their self for their feel goodness of whether they are infected. Personally, I seen the rapid test kit, and where we put it one drops on the rapid kit, and we could see when there is a two, there will be a few bar which is will indicate on the skit, and first two bars indicate there is your symptom, but nevertheless that is only a screening tools. So no need to be so worried, but as a precautions we have to follow the following steps we given in a five. Patiently, we also required to be tested in hospitals. So follow the doctor's instruction. I believe this is five step is very straightforward and easy, but nevertheless, always people will try to find in a difficult and initial stage. These are the things we have to be practiced, and also a systematic approach in order for us to have better controls. Doctor, do you have any add-on informations or the advice on the peoples or publics on these topics related?
Um, yes, Mr. Prakash, I totally agree with you that people have a social responsibility during pandemics. People shouldn't be so self-centered. You have to be, yeah, you might be very strong, but you have to consider about other people who are old people, uh, your own parents. So when we implement the social distancing, avoid going to a public spaces, you have to follow so that you're not going to be harming other people. Okay. Other than that, I think, yeah, as you told before this, if you got symptoms, call them, make sure they know that you are coming. So just don't barge into the hospital, because not only you, there's a lot of other people there who are very susceptible to diseases. You don't want them to be contracting disease from you. So that's one important thing that public fail to understand. I think that's all.
Hmm. Agree, doctor. In fact, yesterday I visited one of the hospital for visiting a patient, but during that latest experience, I could see the hospitals makes more enforcement. Especially when I went to the hospital yesterday, they was screening me, and the security guard is there to stop the visitors to go visit the patients. They're trying to limit one patient at a time, and on the MCO duration, no visitors allowed to visit a patient. I could see the KKM is very prepared and also doing the effective mitigations. And as said the doctor earlier, you mentioned about 80% of people is recovered from disease without needing special treatment. And how it is really managing, doctor? Because people could see, oh, we have work about the virus, and a virus is spreading, and we need to protect ourselves, especially the hand placing. And another way we could see people is not really require special needs treatment. Doctor, can you advise or educate people what is the relation between these two?
Okay. Any virus, any disease, they would like to survive in the society. If the virus is so strong and start killing everyone, then eventually the virus will die by itself. So most of the virus will try to survive, but in the process, they are going to cause mortality. Means they're going to kill few people. Okay, and since this virus is quite new, so technically none of us have a antibody against the disease. So in those situations, depending on your condition or comorbid, whether you have an underlying disease, the chances of you getting a very severe disease is high. So what they saw from uh, the COVID in China and Italy, whoever more than 60, 65, they're very susceptible. Until one part, Italy have to decide because they don't have a ventilator. whoever contracting COVID more than 65, 70 years, they just don't treat them. They just let them die. Okay, we don't want to end up in that kind of situation. That's why we implemented the MCO. We want to limit it so that everyone have access to the ventilator, access to the ICU bed, and the 80% people recover from disease. Yeah, uh, so far we don't have any treatment. It's mostly supportive. We can try with a different kind of medication. I think probably somebody heard about the chloroquine, some magic drug, but then chloroquine was invented 300, 400 years ago. It's not something new. People have been using it for treating malaria for so long. So we are trying with every medication to see which one works. So I think that's all.
Oh, okay. So it is very important that antibiotic of the personal or individual is very important to against this virus. Is that my understanding is correct, doctor?
Yeah, mostly very healthy people without comorbids. The chances of you dying because of COVID is quite low. Because if you see our mortality rate, I think Malaysians is around 1.8%. And out of a 1.8%, if you see their age factors, mostly more than 65, 70, there, there are young people, but then usually they got the comorbids like a diabetes, hypertension, which affects the disease process.
So this shows that every individual we need to be very conscious and help take care, especially on the antibody.
Yeah, the thing is, you might be strong, but your parents might not.
Uh-huh.
So, you want to become the cause for their suffering? Uh, that's the issue. You probably you feel very good. You don't feel like even though you're COVID positive, but then you bring the disease back to your home, infect your parents. They might not survive. So that's the thing. Even if you're living in a society, you have a social responsibility.
Yes, totally agree with you, doctor. Where people always think that they are fit, they are having sufficient health conditions or the antibody, where they always take supplements to measure their health. But nevertheless, we always have the kids and also elderly at home, and also the neighbors, where we always have the direct contact with them. So as a social responsibility, yes, of course, we have to be thinking about not spreading the things, but individually we also as a required to take care of our health, especially the antibody. Okay, so now we are talking about race. Nevertheless, we would like to remain or re-inform again. Those has questions, kindly please post it into the chat box. So later we will having answers from the doctors advice how we can overcome some of the issues where you have the questions. Probably that will be the best answers by the doctors. So in a morality voice, we got see age. We just talked about a couple of minutes ago that the age or risk exposure. So when it is exposure, we could see there's a trending. The bar chart is showing that people having a less age is less chance of the effects and the elderly more affected. So we could see here the two trending. One is about younger generation, one is a elderly generation. Most of us we are in the middle of a generation where we could see the risk is low, but also we could see the record shows many people passed away also in within the middle range. So we always need to be cautious that not only about the elderly or the kids, either also the mid range where you have other symptoms like a doctor's mentioned in the diabetics, high blood pressure. All these symptoms can weakening your antibody, which is leading to the virus infections. And as of 2019 July, the huge number of confirmed case all over the world is about 16,558,289 people infected. This is very, very significant cases. We could see confirmed case. Another things we could see all over the world, we could see 656,000 of people passed away, and this is mainly on COVID-19. This was based on 29 July on WHO. And in Malaysia, we could see a confirmed case as of 30th of July. The confirmed case was 8,964 and recovered 8,615, 17. And that so far is 124. Comparing to other countries, Malaysian we managed to reduce as 124. There will be a people still in treatment, and also the cases is increasing. And on the right hand side, we could see the cases by states where was increasing from those days until now, where was the initial. And today we could see the latest one where we could see on KL we have one, and Selangor we have one, and also Johor and Sabah we have four, and Kedah is one. So these are the latest trending. We could see the increases of the people cases, and people start to worried about, is it next wave, is it we are in the second wave, or we are in the third wave, or we are going to be facing another wave where now is a public holiday, people go back hometown, and most of my friends also go back to hometown for celebration. It's a very wonderful time to having with the family on the celebration time. Another risk we are bringing is it who have infected, maybe they will not have a symptom, but nevertheless it can also transmit. And what is your opinion, doctor, on this matter, and also in Malaysia, how we are going to be facing on next?
Yeah, first wave is already over. We learn a lot of things. Now the issue is, are we going to make use of what we learn? Okay, if we are still being stubborn, okay, I mean, if you're being stubborn, it's not going to affect anybody else. It's going to affect our own self. Whether you still want to, how to say, follow the SOP. I mean, if you're not following any SOP, the one who's going to be affected is our own self and people around us. So yeah, people let you go back, balik kampung, go shopping. Yes, I understand that government or any other government cannot keep their citizens in their house without running the economy. Okay, so end of the day, you have to take your own responsibility and to take care of oneself, and also play a part being a part of the society. That's all.
Okay, thank you, doctor. As the during my research about COVID-19, before I prepared this slide, and after I done my research, I could see has everyone in the world, it's not only Malaysian, everyone should play their role, ensure they are following what is the SOP to protect yourself, your family member, your neighbors, your friends, and everyone. So I will I will say this is a takeaway for all people, that you are responsible as a social responsibility, where you have to take care of yourself and surrounding. So hope you guys will follow the SOP what recommended. So these are the worldwide was infected with COVID-19. So we could see in the portion of the Americas and South Americas, the major part of this country affected. and nevertheless, Europe was spread over the COVID-19, and Malaysia, we also have the spread, and we are the most one of the best uh, reduce or risk mitigation was implemented. We, as a Malaysian, we are very proud about KKM as we implemented and supported by other Ministry of Cabinet. So we was very proud, and nevertheless, it's very risk where people need to be traveling to other countries, and this is where typically people need to be aware how much people exposed to today, and US and America as of today, sorry, as of yesterday, we could see about 4,500,000 over people was infected with this virus. In India, we could see where the second one, which is in the list of third in the all over the world, which is about 1 million people was infected, and where we need to be taking precautions, where we need to start to aware about which are the countries most exposure. Comparing to Australia, we could see that Australia is a lesser. Nevertheless, is people is stop traveling is really needed than only be traveling. So, and another portion we could see in the US itself also, people is dead of the COVID, about 153,000 people. In the United Kingdom is about 46,000 people. In India, about 35,000 people is passed away about COVID-19. So we know how much people are exposed and also dead. This shows that 80% of people, which is not really require further treatment on the recovery, but nevertheless, we have to be taking precautions. And these are the economic impact. We talk about a lot on the medical where people infected. In this infection is also relating to the economics, and we could see the transportation, traveling, luxury, landing, or the constructions, oil and gas, where the because of this COVID-19, people cannot travel, cannot there's no transportation. The oil and gas demands drop, where it is crashing the price. When the crashing the price, were automatically impacted to the economics. So in a good side of it, this we could see the healthcare, medical technology, and science economics was well not impacted, and others are major impact and also minor impacts. So it is not only about people health. This is leading to economics. The economics leading to the country GDP. So country GDP wise, we could see there will be two part. One is advanced economics, another one will be merging markets. So in the Europes or United States, we could see the economics GDP is impacted about 5.9 in the US, and Japan is which is our main focus will be minus 5.2, and they are looking at 2021 to be in a positive numbers in order they are surviving the GDP. So they also doing a lot of action to be recovering. And another hand, in Malaysia, we could see, or Asian, we could see, we are minus 0.6, and we are targeting in 2021 to 7.8. So there will be a very huge in Malaysian point of view, or Asian point of view. So as individually, everyone is responsible to make sure you are breaking the chain within a COVID, which is ultimately you will giving a sign, positive sign to the economics and recovering the GDP. And risk management, which is the last part of it, risk management. Everyone is responsible as a social contribution to society. We need to manage the risk to prevent this COVID-19. This is called a PDCA plan, which is a plan, do, check, and act. This is a switch cheese model. This was developed by the SOS, and people could see we have a virus, we have the cheese. Every cheese there is a loop. So when we have breaking all the loophole here, which is leading to fatality, so there will be could say a primary prevention, secondary prevention, tertiary prevention. So these are the prevention in place where people need to be aware that the medical is coming out with the vaccine, and has the social responsibility. We have to be a social distancing, which is says recommended was 2 meter. We are allowed up to 1 meter, so we should be grateful that we have at least 1 meter rather than people start to worry to run away from people. So government lockdown is also secondary prevention. So, and people need to understand how exactly this cheese model is representing on mitigations. Doctor, what is your opinion or the suggestion you are telling people to understand this model?
Okay, if you see the slide, okay, awareness is already there, social distancing is already there. People are asked to implement hand hygiene, mask cleaning. Okay, then we are doing testing, contact tracing, and hospitals, the doctors. We have to go for a lot of meetings where they keep changing the SOP every single day. Probably morning one SOP, then the new infos comes in, and then they change the SOP in the evening. Okay, and those things. But if you see the first one, there's a vaccine. For now, there's no vaccine. Okay, most probably it's in the other side. But for the vaccine part, uh, I don't think before next 12 months we're going to see any vaccine. Yeah, I know that's not the answer that people expect, but that's the truth. Remember your MERS-CoV, SARS, H1N1, you know, the COVID brothers before this, even they themselves never had any vaccine. So making a vaccine is a very long process and going to involve a lot of phases. So our best bet now is just prevention. Okay, prevention, not even treatment, because treatment-wise, we don't have any strong cure for the disease. You are just playing around, and hopefully, one of the medication will fit the disease and treat it. Okay. So for now, prevention is better than cure.
Okay, doctor. So we understood that vaccine will be not immediately as per the projected timeline, but nevertheless, social distancing is the crucial where we have to maintaining until we have future vaccine in place. So this is the coming back to an individual that you have are responsible of social distancing. So I hope that people will take away on the responsible part of it. And this is a mitigation was given by KKM, which is 3W3C. So people need to be wash, wear, and worn, and also 3C for crowd space, and also calls a conversation, close conversation. So we want to have those are implemented in accordance. So especially recently, I have one experience where I go to the bank, wanted to take it money from a ATM, and next person was very close to me, and I also feel discomfort. It's not only about security, yourself exposed to the risk. Even I went to a shopping complex, also people tends to do that, and especially I had the experience on last week with foreigners where they don't uh, not really bothering about social distancing. So as individual, regardless of your citizen or your foreigners, everybody, you are responsible to follow the SOP. And nevertheless, today is the 1st of August, the government actually launched the mandatory wearing the mask. So everybody, please take away that you are responsible for the SOP and to do the implementation accordingly. And when we're talking about the mitigation, we also need to understand the risk. And these are the risks we could see. The first part where the lowest risk is opening mail. So you receive a lot of letters, or people sometime in office you will receive a letter. That letter the secretary will pass it to you. So there will be a multiple hands has been involved on here. So we need to be very cautious. And talking about getting to restaurant, and especially restaurant, my worry is most of the time it is the fork and spoon. So it will be in the one basket, we put it our hand to take. So how many hands is going into the basket to take the uh, the basket to take the spoon? And my practice all the time from those days, when I take a spoon and fork, I will wipe with the tissue. But nevertheless, it's a tissue where it is a dry tissue. If I place it to another fork and food, it is also same. So this is giving me a personal attention to myself. I shouldn't do that. So, and we could see on the risk moderate low. So we could see playing golf. A lot of people now start to playing golf and walking, riding. So even in the park, we are walking about and say hi to everyone. And also we visit a lot of doctors in the clinic, sitting room, waiting room, um, and also we spending the kids at the playground. So these are the risks we could see, which is hierarchy point of view. We shared the 1, 2, and 3, and 4, and followed by 5, 6, 7, 8. So on the restaurant part of it, on the going to beach or mall, we could see the risk. So people need to see understand where the risk exposure, whether they are fall under the category high risk or low risk. So where the risk mitigation now is coming to the prevention. So people not worried about so much about high risk everything. In the risk point, they will be having high, medium, and low. So we should understand where are we placing. Example, people was screaming and people was upsetting that they can't go gym, MCO, they surrendered at home. Now it's open going to gym. So the gym now become high risk. So it is very important where is the risk. We need to understand that part. So I hope these resources will, which is sharing to you guys, will highlighting which is a high risk for you to expose. So the mitigation will take and or precaution should be taken based on the risk. And now this is a future mitigation which return to work, and I've been to work for last 3 weeks, alternative weeks. So a lot of information is here. Most importantly, we need to assess the risk, which is earlier slide we showed the risk exposure high, medium, low, and your planning your manage your resources, mitigation in place, and allocation of responsibility. This is a typically organization have to look. Yeah, nevertheless, you also have social responsibility. You also can advise your management where communication training is also crucial to have people continuously understand the risk in ensure that people not complacent or reluctant on doing the SOPs. In fact, when I went to office, the people should not sit on the cross area where I have to sit on others place. When I sitting other place, I have to clean up the space where I'm using, and my space was empty, and all of a sudden a person just walk in sitting my place and talking to me, which is I'm sitting the next desk. So nevertheless that place has been crossed, so people is take complacent, oh just a short while. So this is where individual responsibility, and never the shy, never the feel offended. You have to intervene people. So intervention is there is a way to intervention. Kindly please intervene people in politely, and also educate them, so in order for them to learn. So by teaching others or educating others, which is a social responsibility. And this is the posters we have shared recently, which is I have to invest some of the time to come out with simple as possible people to understand the symptom, contingents, and prevention. So typically we're talking about high fever, cough, sore throat, headache. These are the symptoms people always have. But are these related to the COVID? Is a questions. So don't take it a reluctant. Kindly please seek for advice as per this step, which is earlier we shared a 5 steps. And contingents, you always see the air, people sneezing, in especially the office environment or air conditioning environment, and also the personal contact, shaking hands, and objects. We especially in the supermarket, so we could see. I could see people wearing a mask, wearing the hand glove, touching everywhere, and another person without hand glove, they go and touch it. So this all is a things where is infected, and prevention. This is especially um, I would like to ask this doctor. This is very typical where I could see in 1st of August onwards, government has the says everybody mandatory to wear the mask when you outdoor. But the past few months, I could see, and comparing yesterday, I also see people driving with a mask. Could you please share, doctor, do they necessary to wear the mask while they're driving in the car alone?
Okay, I think that's a problem with the most of us. Okay, if you ask somebody why they're wearing helmet when riding a motorbike, the answer will be to avoid summon by police. Even though the main reason is to avoid you from having a head injury in case of a motor vehicle accident. So in this issue, it's still the same thing. People think if they are not wearing a mask, people are going to summon them. You have to know why you're wearing a mask. Mask is only for crowded place. If you're inside in a car with a closed aircon, it's not going to stop you from getting the, how to say, it is not necessary if you're driving alone. It's the same like you're sitting inside your room and watching a TV. Do you wear a mask? No. So here, sometimes the common sense is not so common, you know.
So the takeaway is the mask should be wear in crowded places,
Yes.
not in the car while you're driving. So that is a key message people should be taking away.
If they like to wear mask while driving, it's up to them, but it's not beneficial to them or beneficial to anyone.
Okay. Even in crowded places, we always feel discomfort, and we could see how difficult is a medical person all the ways. They're wearing the mask before the COVID. So in a short while, we feel very difficult wearing the mask, especially walking as well. So we really appreciate and feel the difficulties medical person wearing the mask before the COVID-19. And an individual who now we involve on the COVID-19 is always recommended to wear um, in every places, but you have to wear in mandatory in crowded places. In the car is up to you, but most of the time is not needed. So your needed is crowded places, and the mask is you wear it for 8 hours. You cannot recycle. I could see a lot of people. after they use it, they put it into the dry sun and then they will wearing back. So kindly please take note. There is every product has the life cycle. So life cycle will giving you benefit. So if you overuse it, the life cycle, there will be no benefit. So kindly please take note. And that's all we have for now from my end. Doctor, do you want to add any other things that um, advise the people?
Okay, regarding the wearing the mask, studies shown that wearing any kind of mask is better than not wearing any. So the important thing is not what kind of mask you're wearing, but the important thing is how you're wearing it. If you got the N95, actually N95 is not advocated for public. The only reason is if everybody start buying N95, there'll be a lack of supply to hospitals. So the healthcare people, the nurses, the assistants, the doctors really need the N95 because they are handling COVID cases, which is high risk. Okay, that's first. Second, you have to wear it properly. If every 5 minutes you're going to pull it below your nose or below your chin, it's not going to work. So have to do it properly.
Okay. So do it the right things and do it properly.
Yes, sure.
So so that with that we can see we can beat all together to prevent the COVID-19. I hope with this message will give educate people what is all COVID about COVID-19, what is the risk exposure and what is the mitigation. Even though we knows about this is something that we always consistently need to be educated, need to be shared topics for people awareness. So I think this will be a really useful information for you people. So any question, kindly please post it to the chat box so that we will have some of the clarification. That's all for me. And
Yep.
I would like to thank you for everyone to joining this, doctor.
Uh, okay, Prakash, thank you very much for moderating the session, but I'm afraid the doctor will still be in a hotspot. There are a couple of questions from the floor, and you spoke about masks earlier during your closing presentation. So, any type of mask will be a good idea. Is that what you're saying? Whether regardless of whether it's a cloth mask or three-ply mask or N95, I think the important thing is they need to wear a mask. Is that correct?
Yes, yes. If
Yep.
you can, the cloth mask is okay. You can wash it and you reuse it. Okay, three-ply mask is okay as long as you don't use it for 1 week. Okay, but the thing is, you have to wear a mask and make sure you wear it properly. That's the important part.
Oh, okay, good. Thanks. There's another question from the floor where our current quarantine period is 14 days, but we have seen and read about cases where patients who have not been declared COVID positive during the 14 days, but after 21 days, then they go back for a test and then they are also declared positive. So the question here is really is why is it 14 days and not 21 days?
Okay, when they did the study, the median days to get infected is 8 days. 8 days. So it means you're exposed to a COVID, you are going to be showing symptom by 8th day, and you're transmitting the disease. By 14th day, you probably recovered, you're not going to transmit the disease. Okay. When we take any kind of a statistic, there's always outliers. Either uh, their immune system is not good enough that they are still transmitting disease, okay, or they actually got the disease after the 14 days quarantine, and then that's why they're showing the symptoms after day 21. But currently what they're doing is for the 14 days, they check you first whether you're positive or not. If you're positive, they recheck again on a day 14 to check whether you're still having the COVID virus in your throat. No, they let you go. Still got, they still continue quarantine. Okay, if the first time you don't see any virus in your throat, they check back another 14 days. No, they will let you go. So there's some people not going to follow this pattern, but most of the people will follow this pattern. So if you want to put everyone 20 days quarantine, it will become very cumbersome for everyone. Did I answer your question?
Yes, I believe so. I believe so. I think you answered the question, and I understand that 21 days is sometimes not practical because we're also talking about people's sanity also as well.
Yeah,
They might just go mad after
yeah.
18 or 19 days,
No,
having to quarantine yourself.
even after third day, they start going for wanton mee already outside. So, no right for it.
Yeah, okay. Another question is you have a portion of the slide where there was a slide saying that, I believe it was something like, 80% people can recover without needing special treatment. There was a question from floor. Maybe you can clarify it in a little bit more on that slide or on that comment that you have earlier.
Uh, okay, if you see the disease is worldwide, the mortality rate means number of people dying is around 4%. Okay, in Malaysia is around 1.8%. So that means almost 98%. 98% of people not going to contract. They're going to contract the disease, but it's not going to affect them very much. And another the 80% means another 18% will just probably need the ICU admission. Intubation means they'll put a pipe into your throat and the machine will be breathing for you. So after that you probably recover, because even my own colleagues who are treating COVID patients, emergency physicians, got infected and then was intubated, kept in ICU for 2 weeks, and then they recovered. So this 18% is this kind of people who actually recover. The another 2%, even though you do everything, they will succumb. The thing is, we can say it's a 1.8% or 2% for the population, but for that person, it's 100%. Means is infected is going to die, means he's going to die. For that 1%, if it's 100%. I think, I don't want to confuse you, but that's how it works.
Oh, okay. Thanks for that info. There is another question with relating to mask. Mask seems to be a very hot topic right now.
Yeah.
Well, there are a variety of masks out there, and there's some masks that claim to be self-sanitizing, antimicrobial. Is this true or is this a marketing gimmick?
Okay, because now because there's a summon of 1,000 ringgit if you're not wearing a mask, right? So it's become a hot topic. Uh, Self-sanitizing, what they do is they actually sometimes they put charcoal, the cover with charcoal, or but if when we talk about antimicrobial, yes, it's possible. But we are talking about COVID, which is a virus, so it's not going to be helpful in any way. It's all just a marketing gimmicks. We are not putting, I mean, we are not wearing a mask to filter the virus per se. We just want to filter the droplets, because the virus contained inside the droplets, so it's not going to move away. I mean, cannot move through the mask. So that's what we want. Antimicrobial is all, for me, it's just a gimmicks.
Thank you for that. Thank you for that. I hope everyone is listening. So yes, good. We have another two more questions. Second last question is basically from me. Just asking, how many different COVID-19 strains do we have globally right now? I understand that there are 5 or 6 strains, right? Is that correct?
Okay. This question is quite difficult to say because you have to go through the research papers.
Yep.
But then, so far, what happened is they see in a certain places there's a super spreaders. Means that one fella can actually infect so many people. And when they check the strain, apparently it's a different compared to the strains other people are having. the viruses, they can mutate. To tell you simply, I know we always get a flu, sore throat, okay, all caused by virus. But there's 100 types of virus that can cause the same illness. So COVID-19 also got a different strains, which is kind of difficult to make a vaccine for, because if you have a different kind of versions of the virus, you have to make a different kind of vaccines, because one vaccine is not going to be working for all the strains. But yeah, they still getting a different kind of strains, a stronger strains. In a world of virus, it is quite possible. That's why we are getting the H1N1, all those things, because somehow virus, this one I have to go into bit deeper into the life cycle of a virus. They can actually take a different parts of a different virus and assemble and form a different virus. To blankly put it, that's how it works.
I see. Okay, I see. Understand. Thanks. But on the subject of vaccines, there's another question on the floor. What will be a main factor in helping to speed up the process of developing a vaccine? Is it more money, or is it more people working on it?
Yeah, it actually need both. Okay, you
Okay.
need both money and also a lot of people to be working on it. People are working on a different types of vaccines, and some people are already pushing towards they already completed animal testing, so now they are pushing for human testing. But making a vaccine is a very long process, because first of all you have to find a vaccine that actually works. Second, the vaccine should work to the particular virus. And then third, it must give you like a immunity for some time. You don't want a vaccine that gives you immunity for 1 month, then after that no more. So it will take a very long time to be tested on human subjects. Then you have to see how's their response, whether got side effects. Then only you have to mass produce it. Then you have to send to everyone, and then you have to arrange for everyone to be given the vaccine. It is quite a, how to say, difficult process.
Yeah, yeah, I understand. Sorry to put you on the spot, doctor.
No problem, no
Yeah,
problem.
yeah. Okay, sorry, but I think we have another two more questions, and then you can breathe a sigh of relief. That will be the end of the questions for you.
Sure, sure.
There's another one on with regarding to asymptomatic person. Can they still transmit the disease? Those who are not shown any
Oh,
symptoms.
okay. That's a scary part of this COVID-19. A lot of people will be asymptomatic. Like just now I said, the 80%, they might not show any symptoms at all. They can still transmit the disease. Even the symptomatic patients, before they have symptoms, they will be transmitting disease. So just now I said like day 8, they'll be start showing symptoms. But then by day 6, they'll be transmitting the virus. So so that's a thing why wearing mask is important. Whether the fella is having symptoms or not symptom, better to wear mask, because you don't know whether the fella beside you is having disease, having the COVID-19 in their respiratory tract. Okay.
Yep, thanks for that. And the last one is so we've known that we've got a lot of cases where people have recovered from COVID-19, but that also comes with also side effects, and some have actually have more health problems as a result of getting COVID-19. Some with prevailing conditions, which now basically accelerated and they experience it a little bit more. And for some individuals where they experience a new kind of condition, a new kind of health condition. So, you know, is that a norm for those who have actually who get COVID-19? Would they experience this?
Okay. Generally speaking, any virus infection will leave some side effects. Okay. Just to be sure, telling an example, okay, let's say dengue fever. Okay, it's the same. Dengue fever is a virus illness. Okay, even though you recover from dengue fever, you'll be having some body pain, body ache for next 6 months. Okay, in this COVID, it depends on how bad was the initial infection. If it affects your lungs, okay, it will cause some scarring in the lungs. So it will affect your 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 future well-being. There will be some side effects, but most of the people will recover without any complications.
Okay, that's good to hear. Thank you so much, Doctor.
Thank you.
Over to you, Chua or Pik Pui for the next session. What's going to happen next?
Okay, thank you, Doctor, and also thank you to IR Prakash. Okay, so we will be having a few more workshops and webinars after this today's webinar. So the first one will be a Chartered or Incorporated Engineer workshop, which will be on the 4th of August, 3 to 4 p.m. So please register yourself on our IMechE Near You website. Okay, so for those who are interested. And then next Saturday, we will have another webinar. This is another workshop. We are talking about blended learning by our lecturers from Harold Watt University, Malaysia. Okay, Assistant Professor Nosila. Okay, same time, 10 to 11 next Saturday. Again, please register at the NEU website. And then we have our speakers from Singapore. Okay, Mr. Kogi. All right, he will be sharing 7 secrets, okay, for soft skills and excellence in engineering. So these are this one will be in the afternoon on the 22nd. Okay, on the 22nd, 2 to 3 p.m. This will be from our members from Singapore. Okay, again, register yourself in the IMechE Near You website at the Singapore. Okay, and last one will be by our Business Development Manager for Southeast Asia, Mr. Zen, introduction of IMechE to the students. It will be on the 10th of September, 3 to 4 p.m. again on Microsoft Teams. Please register. This one is also already available in the Teams. Okay, you can actually register on the Google form as well, which is available in the Near You website. Okay, all right. So thank you very much.